Good evening. I hereby call this May the 9th meeting of the Public Safety Committee to order. Before we move forward to our business, as always, I'd like to take a moment, as we like to do, and thank our police department, our fire department, and our emergency management departments for the work that you do to keep our community safe. We know that sometimes it's a thankless and selfless job, but we thank you for the work that you do for our city. For those who aren't aware, items on the consent agenda are typically approved with one sweeping motion unless an item is pulled by a council member or committee member for discussion. We have a light consent agenda. Members of the committee, are there any items that we should pull for consideration? If not, I'd entertain a motion.
Second.
It's been motioned and properly seconded. We'll move to the vote. The consent agenda is passed unanimously. Before I move forward to the one general agenda item, I did want to say that we have all of our committee members present. We have Councilmember Larson, we have Councilmember Mundy, and we have Councilmember Haynes Burke. We also have joined with us today Councilmember Scipio. We thank you for being here. And Madam Clerk, if you'd call item G1, please.
Item G1, update on alternatives to police mental health response model.
Thank you, ma'am. Members of the committee, as you are aware, we have worked extremely hard to put these alternatives to the police mental health response model forward for your consideration. We want to thank the members of the public who provided their input in order to get us to this point. We have a presentation for you today. I want to recognize Assistant City Manager Patrice Toney to give the presentation. You have the floor, ma'am.
Good afternoon, Chairman Taylor and members of the Public Safety Committee. I am Patrice Toney. I'm an Assistant City Manager for the City of Winston-Salem. As you said, Councilmember Taylor, you all, the city and council, has been reviewing potential options for an alternative response model. The city began looking at options in 2020, and in the spring of 2021, the budget and performance management staff, they worked with police staff as well as RTI International to look at collecting data for a pilot project. And so there were pilot projects beginning across the state, many of which are co-response models, but there are many other models that I'll talk about in a few minutes. In the summer of 2021, RTI presented an update to public safety, and in the fall of 2021, staff began meeting biweekly with RTI staff, and then there were monthly mental health cohort meetings with some of the other agencies in the state that are implementing some type of model. And then more recently, we had a community engagement session that I'll speak to briefly in a moment. So the data, I mentioned about RTI working with this Winston-Salem Police Department staff as well as the budget and performance and management team to gather data to look at a pilot project. And so as they were collecting data, they looked at some of the 911 mental health codes in nature. As you see on the list, these are some of the codes that they use, responding codes related to mental health calls. This list is probably not exhaustive. There are probably many calls to service that may not get coded as a mental health related call. This resides at the 911 call taker level. And so sometimes when an officer may arrive on a scene, they may discover there might be some type of mental or behavioral health type of call. And sometimes maybe that call may not be documented as such. And so as we continue gathering more information, I believe this list probably will get longer and better tracking of real calls related to mental health crisis. So they looked at data for over a 3-year period of time, and so within that time period, it was about 9,400 calls that were actually evaluated, about 3,000 calls per year. I'll just briefly go through the next few slides really quickly, just to show you what some of the data looked like. They looked at percent by time of day. And so this shows from 1 to 24, but in reality, about 13 is actually 1 o'clock p.m. And so you see the calls really going up between 12 noon and 10 or 11 o'clock p.m. This is about 10 p.m. here. The highest peak would be around 6 o'clock p.m. And so if we establish a model, we would probably, for a pilot, look at the hours in between this time frame. Then they also looked at percent by month. And so as you notice, there's not really much deviation month to month in terms of the volume of calls, so it's pretty consistent. Based on this chart, it looks like July is probably the most frequency in terms of mental health calls, but it's pretty much throughout the year. This is percentage by day of week, and so it looks like Monday and Tuesday is the highest day in terms of volumes of calls related to mental health. Now keep in mind, these calls are based on the codes that were listed on that original screen as well. This chart shows a percent by district, and I'll show you a map in a minute, but District 1 and District 3 have the highest call volume. I'll show you that in a second. And then this is percent by beat. And so the blue is actually District 1, this is 2, and the green is District 3. And then when you do it by order, percent by beat by order, you see beat 111, 324, 323 are the highest beats. And so to see that on the map, you can't see these beats, but you'll see in general the gist of what this looks like. This dark area to the west of town is beat 323 and beat 324. This is where the highest concentration exists, as well as these two beats, which is 111 and 112. This is really our downtown area. There's a lot of story that could be told in this map here, and probably requires a little bit more analysis. The two things that it was brought out as I was looking at this is that there are, I think, Oak Vineyard Road and some mental health facilities on the western side, and so people can voluntarily commit themselves, or even some involuntary commitments would be counted in these numbers. And then on kind of this downtown and this beat here, I think it's probably beat 221, you have your Highland Avenue Mental Health Center. And so those numbers probably a little bit arbitrarily high just because they have those facilities there where people involuntarily commit or involuntary. But so the other piece is that people's comfortability in calling 911 related to mental health calls is a possibility, and a little bit of education. But I will say there are some other resources in the community for mental health crisis that maybe people tap into. But this requires a little bit a deeper dive in terms of what is the story behind the map. As noted, there was a community input session on April the 6th. It was held right here in the council's chamber. It was co-facilitated by professors in the Winston-Salem Justice Studies Department. And so this was just an opportunity for the community to weigh in. There was great representation among community members, leaders in the mental health arena, some mental health advocates and professionals. There were a couple of MSW students as well as their professors. There were people with mental illness, family members of people with mental illness, and just some concerned citizens who weighed in on a potential response model. And so that information and their input was well noted and well documented and reflective in what the recommendation will be. And so when we look at alternative strategies, clearly prevention in a community is key. So really tapping into some of the existing programs, getting people into services or connected to services that exist, and looking at alternative means as relates to when people call into 911. And so There are other alternatives to police response for these mental health calls. Reform would look like ongoing training, not only for officers, but also some community information and awareness about how to call in, what to say, what's medical versus when you require a police response. And so engagement would be this ongoing opportunity to engage the community for input and feedback on this model, which we intend to do. So the project goals would be, one, to divert individuals in mental crisis with a mental illness away from the criminal justice system. Number two would be to create an alternative to police response to nonviolent mental health calls and provide follow-up services. And the third goal would be to reduce the per capita number of 911 mental and behavioral health calls for service. And so what the recommendation would be is to create a pilot program that is a true alternative response model. We tend to like acronyms, so I just came up with this. We can change it, but I called it Winston-Salem Bear Team.
I kind of like it. It works, yeah.
Good. Thank you, Councilmember Taylor. Is Behavior Evaluation and Response Team. And so what this team would be comprised of is 7 staff members. This would be a lead clinician, so this would be kind of the coordinator, behavioral health person, would probably work a standard schedule so that they can have oversight and provide input to the program. 4 clinicians, these would be licensed professionals. They would work Monday through Friday on a staggered schedule with times from about 8 a.m. to 10 p.m., which that could be adjusted based on the need and as we gather more data for the highest call volume. Of course, keep in mind this would be just under a pilot stage. And then 2 crisis counselors with a master's degree in counseling or social work or something of that nature, and their shifts would be probably 1 to 10. This will be a staggered shift, and then they will also be available on nights and weekends for callback when we're not staffed on the normal schedule. The team would also need uniforms, vehicles, radios, all of the items needed to successfully respond using radio and being able to have access to everything and having vehicles to respond to calls. Also, I'm proposing that this unit be housed under the fire department. And so Councilmember Scipio is looking like, why fire department? And so the fire department is non-law enforcement in a sense, but they are first responders. They know how to respond to calls for service. They primarily respond to many medical calls. So they are typically the first responders to medical calls on the scene. You know, we hope they will all be kind of fire calls, but they are first responders, and they have that level of expertise. They also have stations in the community, fire stations, and so it's already a location that we can house this unit. I imagine that they would be in different fire stations. They are open 24 hours and are staffed 24/7, and so having this connection with the fire department, I think, will be a great partnership. I've already spoken to the fire chief, and he is totally on board, understanding that, you know, fire doesn't have to be the expert, and no one should. We would want to hire a team that's the expert in this area, in behavioral health. We're also projecting the budget to be around $700,000. And to propose using ARPA funding. There is some money earmarked that was potentially for this type of project program, and so the funding is there and available if we are willing to do that. I'll also just make a mention of a case on last Thursday where there was a person in a tree. You all got the one call about the person in the tree. And so that probably, if we had a bear team in place, would have been an appropriate response for the bear team to help negotiate the person coming from the tree. The fire department did respond because they, of course, have their ladder truck, and then you could have the bear team that did not require a police response. Now, police responded, and they did a great job, so I don't want to take that, but police is woefully understaffed, and certain types of calls just do not require police response. And so looking forward, it's really, really important. I just want to point out that clearly at the 911 level that this would take tremendous training to make sure that the 911 dispatchers really assess the call, and if they determine this is a mental health, truly mental health, behavioral health type of call, that you do not need a police response. Right now, you call 911 and it's police, fire, or EMS, ambulance service. And so they can make that determination if it's a medical in nature or if it does indeed require a police response. Last month, you all approved the merger, the consolidation of Fire 911 with EMS 911. And so that totally makes sense as we look forward to separating out medical calls versus police calls, that this project and pilot project would make sense when 911 operators are determining when to send a behavioral health. I would imagine that there would be times where you could not fully assess. The officer goes on the scene, and then they would still be able to tap into the team, and so they could respond and do follow-up work as well. So the next step would be to hire the bear staff, which is what I proposed on the previous slide. The county has a mobile integrated healthcare team in place. They are also woefully understaffed. They use community paramedics to staff their team, and they are right now only doing kind of follow-up type of work. So this bear team would be a little bit more proactive and respond to 911 calls, and we can partner with them to kind of expand and collaborate on their program. Once again, to train the 911 dispatcher in assessing mental health related calls, and probably trying to get a better sense of the CAD codes that would be clearly identified as mental health or behavioral health related. Long-term, I'm already looking forward to maybe potentially embed mental health professionals in the 911 center. And so you could have people who have this expertise in your 911 center and help triage some of the calls that come in to better assess what's needed and who should be responding. And then at the end of the pilot, we would need to evaluate the data and look for additional funding sources to potentially expand. Obviously, we would want some feedback from the community on how it's going. We'll look at some new numbers and data. We'll provide RTI with some updates, and so there will be a full assessment of the pilot program. If you all support this concept, we would come back in June for the City Council's permission to appropriate the $700,000 budget towards this effort. And so with that, I'll be happy to answer any questions.
Thank you for the presentation, Ms. Tony. At the last meeting, we saw in real time our real crime center with the cameras. Is very innovative, and I think this particular pilot program, as it's being presented, is very innovative. I think it's going to do a lot of good. Members of the committee, council, are there any questions? We'll start with Mr. Mundy, and we'll work our way over.
Thank you, Mr. Chair, and thank you, Assistant City Manager, for a great presentation, and I'm so glad to see us moving in this direction. I have a couple of questions, if you'll just indulge me. One, this is not for you to... Is it on now?
I hear you.
This is not for you to answer now, but what I would like to know is, when we evaluate the data, what will our criteria be for determining success and whether we move forward? Let's get some tangible measurements so that we can know when we've achieved success. You mentioned uniforms. Can you speak to that a little bit more?
Yeah, so it would not be, clearly, it's not law enforcement, these would be clinicians, but something still identifying them as connected to the city. It might be just a T-shirt, but we know we need to budget for that so that they have a uniform look that doesn't appear intimidating. You know, we heard from the community group that, you know, just a presence sometimes of an officer could escalate someone having a mental health crisis and create more trauma. So making sure the staff is presentable in a way that people don't have any extra trauma from their presence, but still identifies them as professionals.
Great, and thank you for taking that into account. I know that was a concern that our citizens had. Will part of the responsibilities, if you will, of these folks who take the calls, will they help these individuals access mental health services if they're not already connected to an existing mental health resource?
Yes, Councilmember Mundy, that's a great question. I think the intent would be this ongoing connection and follow-up, as well as connecting people to actual resources in the community. We have some great existing resources. I even spoke to Andy Hagler from the Mental Health Association, and there are a number of groups, and like I said, I mean, even with the county partnership potential, that we would definitely be able to provide some resources and make sure this team serves as a resource to people with mental health, in a mental health crisis.
And one more, so I don't take up too much time. One of the attendees of the public meeting put forth a suggestion that I had as well, and that is some type of a registry, so that if someone is living with a child or an adult with mental health issues, that they can register in some way and make sure that if a call comes in and it's not identified right off the bat as a mental health call, that they have another source to go to, again, to avoid sending police when that's not the appropriate response.
Yes, absolutely, Councilmember Mundy. And I do remember the lady was a MSW student, and she made that suggestion about the registry. And, you know, Councilmember Taylor talked about the Real Crime Time Center as they presented with this opt-in approach to add your cameras to the center. This would be something similar. People could opt in to have their loved one registered and their address. And so hopefully that information would come up, so there's this awareness that there is a person with the mental health potential crisis, and be able to send the appropriate people as needed. Yes.
Thank you. I'm just really glad to see all these steps and considerations as you put this program together.
Thank you.
Councilman Larson.
Excellent presentation. A couple of follow-ups. On page 3, where you actually list the data criteria of 6 or 7 different calls that come in, do we have quantitative data on those categories that give us a baseline as to what those calls consist of, that would give us some comparison a year from now, 2 years from now, as to see how we're handling it? It may fluctuate seasonally. I have a question sort of about domestic disturbances, though. And does that fall underneath the first category of nonviolent or violent mental health categories? How do we handle domestic disturbances in these where counseling might be of value?
I think that, Councilmember Larson, I would need to double check with PD how they determine that at call take in particular. I think it varies just depending on the situation. Clearly, there can be domestic situations that, you know, someone has a knife or they have a gun, or it could be just a verbal dispute. I mean, there's such a range in what that could mean. Doesn't always mean, you know, that's debatable, but it doesn't always mean this would be a mental or behavioral health situation or identified as that.
Well, we come into those kind of gray areas. So is it sort of policy to dispatch both the mental health and a
Yeah, I think if there is an active situation where there's any violence connected, you probably would send an officer, just as a standard. But if it's just purely, a homeless person, or it may be someone voluntarily wanting to be committed, the team could go and help that person get to a facility and stay with them through the paperwork and those type of things. That would not require an officer's response. So the ones that are clearly nonviolent, and it's not a domestic probably in nature, yeah, so that's where the training at the 911 operator.
That's called dispatcher is going to have to have that
right.
judgment made. We had an incident in the South Ward, which the city attorneys helped me with, dealing with barking dogs and neighbors complaining to each other. And then we tried to find a mechanism for arbitration to get somebody in there to actually get them to talk to each other. Is this potentially, and they call the police, of course, to come and address, the police come again and what have you. Is this an occasion, is this the kind of work also that we could see some support from mental health consultants?
I think it depends. Every case, like I said, would need to be evaluated for what it is. But if it's an active disturbance between neighbors, between two people, it may require a police. But once again, this will be, a piece of it would be educating the community about what it is they're calling about. And so when the operator is asking you, do you want a police, we'll probably send an officer. If they are saying this is a medical crisis, mental health crisis, the operator will send it to EMS and the fire 911 side, and then they will do some level of screening and potentially could send this alternative response team.
Well, they're calling 911 now for barking dogs, and so.
Yeah, those are non-emergency calls and should not be used for 911 should not be used for barking dogs. So hopefully they're not.
They're looking for help from the city, and we don't have a mechanism right now. I think it's going to be interesting as you go through the year to actually itemize the kind of calls that are made and how they're differentiated. The list that you provide is useful, but I don't think it's inclusive enough to really get an understanding of the scope of the variety of calls that come in that would be useful for this service. And so as we look toward itemizing it, could we get a better, fuller list as 2 years, a year from now, whatever. But thank you for this work. It's excellent.
Thank you.
Thank you, Councilman Larson. Councilwoman Scipio.
Thank you for the presentation. You've sort of summarized all of that data and information we got from the community, and it seems very clear what we could do on a pilot program, and I appreciate that. I have a few questions, and it's just logistics. First of all, we have already stated, and it's real clear, that our 911 operators are definitely going to have real clear, good listening skills to determine who to dispatch. And it might be difficult sometimes. So with this BEAR team under the fire department, they will go out, and I assume that they have the capacity when they get there, see a situation, to immediately call for backup with the Winston-Salem Police Department if that's necessary.
I imagine so. I think they would be equipped with radios. I mean, the same as fire personnel, EMS. You would have access to police radios to call in if necessary.
Yeah, that would be very important, that they can call for backup when the situation is not necessarily totally mental health. So there was an incident, and I guess the converse to that is if public safety's dispatch, say it's the police department, and they get there and they can assess that this is a mental case issue, the BEAR team wasn't contacted, the police department can call in the BEAR team to come. So that means they're going to have the vehicles with the lights and stuff, and they can run the stoplights and to get there, right?
I'm not
Just like any other emergency vehicle, they'll be
I
equipped
know that they
way.
will respond, probably not with blue lights and sirens, is not the intent at this point, but they
I
would definitely.
think that's really important. We had an incident on, and I don't know if you know about it, but you probably do, on New Walkertown Road at the BP last week. I happened to be driving down New Walkertown Road, and I saw the incident that the police men were there chasing somebody, and they were there in good force trying to apprehend this person. I think something may have happened at the BP, and as I drove by, I saw that this person was definitely a person who had some issues, just by looking at their dress, how they were moving, the things they were carrying. And I said, oh, this would be probably a good thing for a mental health professional to come. Now, he may have committed a robbery at the BP, I don't know. But I think that I was told that they did take him in for mental assessment. But here again, if the police was there first, they had to do what they had to do. But the bear team needs to be there in situations when they weren't called to come in and help. So I think that it's going to be real critical that our 911 dispatchers can assess as competently as possible. And I know they won't get them all right, but we're going to try. I think the pilot would certainly help us to serve the public better. So I appreciate where we're going with this.
Thank you, Councilmember Scipio. And I'll just, one note, I think there's a trend to use more civilian for enforcement. And so you all were on a legislative call last week to talk about civilian traffic enforcement. And so there's this growing opportunity to use non-sworn police officers to handle non-criminal, non-police types of calls. And so I think this would be one of these type of situations.
I would agree with you, except I don't want to have resident vigilantes and all of a sudden have people shooting black men because they're walking in their neighborhood and they think that they're doing something. So I think we have to be careful.
Oh, no,
On that.
only in the structured program that we have.
Thank you, Councilwoman Scipio. Any additional questions for Assistant City Manager Tony?
One follow-up.
Councilman Mundy.
As you look at who's going to do this training, please continue to call on the resources of the citizens who have been so engaged in this and in fighting for it. They now have a dog in the race, and they want to make sure that this pilot program turns out well. So we're out of our field of depth. Use those folks, please, as a resource so they can help us go in the right direction.
Absolutely, thank you.
Any additional questions or comments for Ms. Tony? Councilwoman Burke.
Thank you, Ms. Tony, for this presentation. I see that we're going to evaluate the pilot in a year. That would be next May. Is that correct?
Well, we need to get the people hired and get some of the logistics down, make sure everyone's trained on the process. And so I would anticipate, and then you all need to pass the budget. There's a couple of steps before, so probably not May to May, but probably more like August to August would be.
Okay. So my request, and I don't know if it's possible, rather than wait 1 year to evaluate, if we can reduce that time down, maybe quarterly.
Absolutely.
And the evaluation, I would hope it would include some of the more specific, detailed information that Councilmember Larson suggested.
Okay, absolutely. We can definitely come back to public safety with updates even once we launch the program, and then bring back quarterly updates as we move forward.
Yeah, I was going to suggest if we implement the program, logistically, we'll probably have to do it for the year, but it makes sense because of the budget, but it makes sense to bring it back quarterly so we can just take a look at it, make sure the program's going well, and that it's performing the way we wanted it implemented. Any other questions or concerns or comments for Ms. Tony? Ms. Tony, thank you. I will say this decision and this pilot program wasn't done in a vacuum. It was done as a part of a one-team effort. When I say one team, we typically tend that to mean the partnership between the council and the staff. But I will say that one team certainly should and always and does at this time include the citizens who brought this forward to our attention. I want to thank all of the mental health professionals. I want to thank Hate Out of Winston-Salem for bringing this to us. This is an example of your government at work. And with that being said, we typically don't do this at the the committee level. But is there, before I ask this question, did you want to say something else, Councilwoman Scipio?
Yeah, I wondered, will you vote on this to go to the council next week, or?
Well, this is actually an update. So I believe if the committee, by consensus, agrees to this, then there's an item that's going to be prepared. It'll come back to committee and to finance for consideration at that particular time. But we wanted to work out all the kinks before we took it that far. So with that being said, working out the kinks, if I may take a moment of privilege, the members of the committee, is there anyone who wishes to be heard on this item? We want to make sure we're getting all input and updates because we want this thing to be fine-tuned. We want it to not be something that we want. We want it to be something that's inclusive of the community and something that you want. So is there anyone who wishes to be heard on this item? Seeing no one, it appears that it is a consensus to move forward with the pilot program. Ms. Tony, if you'd get the item prepared to come back to the committee letter for consideration, we'd appreciate that. That concludes our consent and general agendas. Members of the committee, council, public, is there any other business that should be brought forward for consideration for the good of the order? Seeing no further business, we hereby consider this meeting to be adjourned.